Right, so welcome again for the femoral nerve block and fascia ileaca block scan. So we've seen in the tutorials, the femoral nerve arises from the lumbar plexus is one of the core peripheral nerve blocks to easy to learn. And I think anyone who was interested in doing peripheral nerve block, I would start with the femoral nerve block for two reasons. The first that is a femoral nerve block is a superficial block, plus it's a perivascular, making it much easier to identify by its intimate relation to the femoral sheaths containing the femoral artery and femoral nerve, as we're going to see now. So as we see, it's one of these blocks which can be used for all anterior thigh and for the hip joint and for even the knee joint. And it's one of these blocks which is really recommended to be done actually in theaters or A&E. We find it very common block to be done, and it's advisable to learn this block really. Okay, so moving into the scan now, you can see, guys, as I mentioned, is that the femoral nerve block, it's one of the most important things. Like any other type of block, it's the most important thing is your ergonomics. So your patient and machine should be in very easy position, so you don't do the block while you're in a difficult position. Someone like me having a back pain, if I've been in struggling with doing the block, my back would affect my performance of the block. So it's very important to have an easy ergonomics and easy position for yourself. Also, the safety is very important, guys, as we mentioned, all about the safety precautions of doing the block. Also, we use non-touch technique for doing the block, and if you are doing a catheter, it's complete aseptic condition, or you should do the block under complete aseptic conditions. So this is the essential, plus also the availability of the interlibid and all the monitoring and all the other safety precautions we mentioned in the PowerPoint. Now for doing the femoral nerve block, okay, as you can see here, what we are trying to see is, don't look, guys, into, don't search a nerve when you put your probe in. Try to find other structures. And when you find the other structures, you will find your nerve. So you try to find where is the artery and vein, the vascular structures. So in the femoral crease, sorry, in the femoral crease here, what you're going to see when you put your probe in a linear position, okay, you will start to feel at in the midline of the screen here, a pulsating structure. This is the artery, okay, and there is another collapsible structure here, okay. So this is the vein. So again, so this is the artery and vein, okay, and then orientate yourself to the muscles around this area here. So we'll have the ileaca muscle, as you can see here. This is the ileaca muscle, okay, and on the top, the muscle which come on the top here, this is the sartorius muscle, okay. So this is the sartorius muscle here, and down is the ileaca muscle, all right. Now you've seen the vessel, you've seen the muscles. So now try to do some manipulations by doing a pressure of your probe. You can see, I'm sorry, you can see here again the vessel. It's very nice division of the femoral artery into superficial femoral and profunda. So you follow your artery up, okay, until they unite together to give you the femoral artery, and then you slide your probe laterally and do some tilting maneuver. And the tilting maneuver and pressure maneuver, this maneuver is meant to try to see the femoral nerve. And this is referred back to the physical property of ultrasound called the anisotropy. You know, the anisotropy is one of these physical properties that you have to be very perpendicular to the scan structure, okay? Because the nerve, it does course a little bit over the muscle and under the vessel, so it makes it the probe is not perpendicular to the skin to give you the good image. So you have to a little bit to do some pressure and tilting until you start to see the femoral nerve here, okay? So if you can do this freeze pressure, okay? So yeah, so it's freeze again, sorry, yeah. Okay, so freezing, okay? So you can see here, this is the femoral nerve, right? And you can see here, this is the femoral nerve here. And the femoral nerve, it lies over the iliacus muscle, right? And there is two fascial planes, one in the top here, which is the fascia lata, and this is the fascia ileaca, which enclose the nerve, okay? So fascia lata and fascia ileaca, okay? So unfreeze again. Right, so back again to the scanning, become lateral. You see, it's very flat structure here with the femoral nerve, right? So this is the femoral nerve again. Okay, and then the top of this fascial plane is the fascia ileaca. Okay, guys. All right. To enhance the visibility, you have to do this pressure and this tilting cutter. So if you notice here, when I'm doing cranial tilt, you can see the nerve. If I'm doing caudally, you can't see the nerve disappear. So you have to do a little bit of tilting and pressure to see the nerve. Okay. So again, this is the femoral nerve. So just can you do another freeze, please, Joshua? Okay, so you can see the screen here. So this is the femoral nerve here. Okay, this artery. Please, guys, I've seen people considering this hyperechoic structure, right structure here, just beside the artery, as a femoral nerve. This is not the femoral nerve, and this is not the femoral nerve. This is another physical artifact called post-acoustic enhancement. So this is an artifact, and this is also an artifact. So this is the femoral nerve. It's a flatter structure. Okay, this is a flatter structure, lies over the muscle here, which is the iliopsoas. And you have the fascia ileaca, and this is the fascia lata here. Fascia ileaca gives you a pocket, which is anterior posterior layers, to enclose the femoral nerve and making it this. That's why if you want to do fascia ileaca in femoral, you go at this level here, you definitely blocking the femoral nerve. We go to the scan again. Okay. So what happens if you can't do the femoral nerve, or is it difficult to see the femoral nerve? There's two tips two other tools you can use it. The first thing is you can use a nerve stimulator to block, or you can find the femoral nerve, because the femoral nerve, it's one of these blocks which can easily block by nerve stimulator. It just locks to the artery using a searching mode about 1 milliampere and reducing it down to 0.4 to 0.4, 0.3 to 0.4. If you get a batellar dance here, okay, so this is a very good sign of femoral artery stimulation. And usually the needle will be stimulating. So actually the sartorius, if sartorius or batellar dance is good, acceptable in boy for stimulation. The other tip, if you can't find the femoral nerve, you can do the fascia ileaca. And this is the second block we're learning it today. So the fascia ileaca can be done at this level here. So if you can just again, so gradual, can you freeze again? So the fascia ileaca, as we mentioned, there is infrainguinal, which was described a little bit earlier. You can see here. This is the fascia ileaca here. This is again the iliopsoas. So it's a junction between the medial 2/3 and lateral 1/3. And you can see if you get your needle out of plane below below the fascia ileaca and over the iliacus muscle, and you do the injection, it's a field block. It's one of these blocks which requires a larger volume, things like 30 to 40 mil, 40 mil at least. I would inject 40 mil to involve the femoral nerve and the other cutaneous nerve, which is it comes on the way here. Can you unfreeze again, please, Brushel? So actually, I can show it to you also the lateral cutaneous. Sometimes if you can't see the lateral cutaneous, also this is very small cutaneous branch. You can't see here the lateral cutaneous lies in this pocket here. I think this is one of these branches of lateral cutaneous, lies over the sartorius muscle. So again, it's from medial to lateral here. You can see a pocket which lies the lateral cutaneous nerve related to the anterior superior spine. So if you down the fascia ileaca, so definitely you are blocking the femoral nerve and the lateral cutaneous nerve, which is lateral cutaneous is a cutaneous supply for the lateral side of the thigh, while the femoral nerve give you a very good innervation for the hip joint, or in case of any hip surgeries. Okay. Now, in 2011, this Peter Hepper, he described another nice suprainguinal approach. And why the suprainguinal is more favorable now? Because of different reasons. Actually, one of these reasons is that actually the cutaneous supplies of the femur of the hip fractures is not only coming from the lateral cutaneous, it also comes up from the subcostal and L1 subcostal and iliohypogastric nerve supplying here. Plus that you are injecting a larger volume, so you involve the femoral and the lateral cutaneous plus the obturator, and you involve the high branches, the femoral nerve, give a high branch of a femoral nerve higher in the pelvis before it travels down to the thigh. Okay. So in order to do the suprainguinal fascia ileaca blocks, you have to feel the anterior superior spine. You can see it here, and your probe is a little bit, I would say, longitudinal or directing to the umbilicus. Okay, so you can see the hyperechoic structure here of the anterior superior spine. Okay, and what you need to do is slip the ultrasound probe a little bit down. Okay, so when you slip the ultrasound probe again from ultrasound, you see another bone here. Okay, so this bony structure here, it's called anterior inferior iliac spine. Okay, so this is the anterior inferior iliac spine, was part of the ilium, and then you have a very nice. Can you just a second? Okay, so just please. So if you can show me here, so this is here again. This is the iliacus muscle, and this is the sartorius, and this is part of the abdominal muscles for the internal oblique. So your needle should come from lateral, from podiac to perineal direction over here, and then pierce the fascia ileaca and over iliacal muscle, and then you inject larger volume of local anesthetic as much as you can to get the higher branches of the femoral nerve. Another point, so just can I do it again? So I'm freeze. So it's very easy, guys. So again, just this is the anterior superior spine. So this is the anterior superior spine. The probe directed towards the umbilicus. Okay, and then again you slid the probe down. Okay, so you can see here very nice bow tie. What's called the bow tie sign. Okay, so again this is the sartorius, internal oblique, and over the iliacus muscle. All right. Okay. So again, anterior superior spine, and then you slit anterior superior spine here, and then you slit it down, so you find the anterior superior spine or part of the ilium, which is used as ventilation. Now, I just want to give you another tip when doing the femoral and fascia ileaca. So, guys, you see here that this is here anatomically or surface anatomy. This is the femoral crease, and the inguinal ligament is about 2 to 3 centimeters higher. So, when we're doing the femoral block, don't do it at the level of, don't do it too much higher below the inguinal ligament or higher the inguinal ligament, because this you are going now to the pelvis or to the pelvic organs. And don't do it much lower down, because the femoral nerve does divide below the femoral crease. So you do it at somewhere between the femoral crease and the inguinal ligaments. Okay. So also the inguinal ligament, doing the block is extremely painful. So I would suggest just somewhere between the femoral crease and the inguinal ligaments. So again, just as a matter of revision, so we can see the vessel. So when you do the scan, don't look into the veins, don't look to the nerves, don't search for the nerves, just search for your vessel. So you can see here, this is the femoral artery and collapsible femoral vein. Okay, and then you look into the muscle, you see the sartorius in the top and the iliopsoas muscle, and you start to see, try to do the pressure and the tilting to start to try to find the nerve, which is the femoral nerve here. Okay, so this is the femoral nerve. Okay, you can see here that this is the femoral nerve here, femoral nerve. Okay, and your needle coming from lateral to medial. All right, and suprainguinal, again, you can do the infrainguinal here somewhere, lateral. You can do from podiac to cranial, all right? Or you can do it suprainguinal, scanning the anterior superior spine, the bony structure here, okay, and then you slit the probe down so you can see the bow tie sign, a new injection, as you seen all in the video. The injectate will go further up, so inject as much as you can see the vascular. Can you see where's the color of the blood? No, just unfreeze. Color doubler. Yeah. So you can see another vessel here. Yeah, so this is a pulsating vessel. So you can see this is the superficial circumflex iliac. So you have to be very careful with doing the block at this level. Okay. So this was a summary of the femoral nerve block and the lateral cutaneous and fascia ileaca. Again, the fascia for someone who's interested for the lateral cutaneous. So lateral cutaneous going. So this is the femoral nerve. So sorry. So this is the femoral nerve here, femoral crease. And you're going medial, 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 and then boom, you can find a pocket here, which you can find the lateral cutaneous in the top, above the sartorius muscle. For someone interested, there is another medial direction is actually the obturator and pectineus muscle and adductors. You can see the obturator nerve here as well, but this is beyond the basic blocks we're talking about today. So this is a femoral nerve, arching, and femoral nerve very lateral to the arch here. Okay, that's fine. I think that's the end. So thank you very much, guys.